D-dimer test is used to rule out the presence of A. Blood clots, B. Tumor, C. Glucose, D. Immunoglobulins. And the correct answer is A. Blood clots. D-dimer test is used to help rule out the presence of inappropriate blood clots, that is thrombus. Some of the conditions that the D-dimer test is used to help rule out include deep vein thrombosis, pulmonary embolism, stroke. This test may be used to determine if further testing is necessary to help diagnose diseases and conditions that cause hypercoagulability, that is a tendency to clot inappropriately. A D-dimer level may be used to help diagnose disseminated intravascular coagulation, that is DIC, and to monitor the effectiveness of DIC treatment. If glaucoma is left untreated, it leads to A. Conjunctivitis, B. Trachoma, C. Cataract, D. Blindness. And the correct answer is D. Blindness. Glaucoma is a progressive disease, meaning it gets worse over time. If a person does not get regular eye exam and glaucoma goes undiagnosed and untreated, then as it gets worse, high pressure inside the eye damages the optic nerve. This damage impairs vision. It cannot be reversed. Vision loss begins around the edges of the visual field. Eventually, a person's central vision will become blurry and the person will go blind. Which of the following is a cyanotic heart disease? A. Tetralogy of Fallot, B. Aortic stenosis, C. Pulmonic stenosis, D. Patent ductus arteriosus, PDA. And the correct answer is A. Tetralogy of Fallot. Infants with tetralogy of Fallot can have a bluish looking skin color called cyanosis because their blood doesn't carry enough oxygen. At birth, infants might not have bluish looking skin, but later might develop sudden episodes of bluish skin during crying or feeding. Most common malignancy in children. A. Lung cancer, B. Oral cancer, C. Leukemia, D. Hemophilia. And the correct answer is C. Leukemia. A cancer of the bone marrow cells, that is leukemia, is the most common type of malignancy seen in children. A positive Murphy's sign is seen in A. Appendicitis, B. Pancreatitis, C. Cholelithiasis, D. Cholecystitis. And the correct answer is D. Cholecystitis. A positive Murphy's sign is seen in acute cholecystitis. Murphy's sign is checked in patients with acute cholecystitis by asking the patient to take in and hold a deep breath while palpating the right subcostal area. If pain occurs on inspiration, when the inflamed gallbladder comes into contact with the examiner's hand, Murphy's sign is positive. Which hormone is secreted by the pineal gland? A. Melatonin, B. Adrenaline, C. Progesterone, D. Testosterone. And the correct answer is A. Melatonin. Melatonin generation by the pineal gland peaks during the nighttime hours. Melatonin induces physiological changes that promote sleep, such as decreased body temperature and respiratory rate. During the day, melatonin levels are low because large amounts of light are detected by the retina. Light inhibition of melatonin production is central to stimulating wakefulness in the morning and to maintaining alertness throughout the day. Premature separation of the placenta from the uterus before childbirth is called A. Placenta previa, B. Habitual abortion, C. Placental abruption, D. Vesicular mole. And the correct answer is C. Placental abruption. Placental abruption is also called abruptio placentae. It is an uncommon yet serious complication of pregnancy. The placenta develops in the uterus during pregnancy. It attaches to the wall of the uterus and supplies the baby with nutrients and oxygen. Placental abruption occurs when the placenta partly or completely separates from the inner wall of the uterus before delivery. This can decrease or block the baby's supply of oxygen and nutrients and cause heavy bleeding in the mother. Placental abruption often occurs suddenly. If left untreated, it endangers both the mother and the baby. An immovable joint is called A. Amphiarthrosis, B. Diarthrosis, C. Synarthrosis, D. Polyarthritis. And the correct answer is C. Synarthrosis. Synarthrosis is an immovably fixed joint between bones connected by fibrous tissue. An example of joint of synarthrosis is the sutures of the skull. The second stage of labor involves which of the following events? A. Full dilation of cervix and birth of the baby, B. Expulsion of placenta, C. Puerperium, D. Softening of the cervix. And the correct answer is A. Full dilation of the cervix and birth of the baby. The second stage of labor starts when the patient's cervix is fully dilated and ends when the infant is completely delivered. Which of the following is the most common cancer of oral cavity? A. Adenocarcinoma, B. Melanoma, C. Squamous cell carcinoma, D. Sarcoma. And the correct answer is C. Squamous cell carcinoma. More than 90% of oral and oropharyngeal cancers are squamous cell carcinomas. This means that they begin in the flat squamous cells found in the lining of the mouth and throat. The most common locations for cancer in the oral cavity are tongue, tonsils, oropharynx, gums, and floor of the mouth. What do you call a cancer of epithelial cell origin? A. Hodgkin's disease. B. Carcinoma. C. Sarcoma. D. Leukemia. And the correct answer is B. Carcinoma. Carcinoma is the name given to the cancers that start in epithelial cells. These cells make up the epithelium, which is the tissue that lines the surfaces inside and outside your body. This includes the outside surface of your skin and internal organs. What is the most common causative agent of erythema multiforme? A. Penicillin and sulfonamides. B. Malignancy. C. HSV infection. D. Systemic lupus erythematosus. And the correct answer is C. HSV infection. Herpes simplex virus is the primary cause of erythema multiforme. Both types of herpes simplex virus can cause the condition, but HSV1, which also causes cold sores, is responsible for most cases. What tumor is characterized by findings of Schiller dual bodies on histology and raised levels of AFP in your blood test? A. Embryonal carcinoma. B. Teratoma. C. Yolk sac tumor. D. Sertoli cell tumor. And the correct answer is C. Yolk sac tumor. Yolk sac tumor is characterized by significantly elevated serum alpha fetoprotein level. Schiller dual body is the defining morphologic feature of yolk sac tumor. Surgical fusion of a joint is known as A. Arthrodesis. B. Arthrotomy. C. Arthroplasty. D. Nailing. And the correct answer is A. Arthrodesis. Arthrodesis refers to the fusion of two or more bones in a joint. In this process, the diseased cartilage is removed, the bone ends are cut off, and the two bone ends are fused into one solid bone with metal internal fixation. Mani is feeling ill and he thinks he might have meningitis. What is he particularly sensitive to? A. Light. B. Sound. C. Touch. D. Smell. And the correct answer is A. Light.
He was very sensitive to light. He was very sensitive to light.
A sensitivity to light or a dislike of bright lights is an early warning sign of meningitis. If this symptom is present, check for any other symptoms of meningitis. If the child or adult is difficult to wake or in a drowsy and confused state, they could be exhibiting early signs of meningitis. Athlete's foot is caused by A. Bacteria. B. Virus. C. Fungus. D. None of the above. And the correct answer is C. Fungus. Athlete's foot is caused by the same type of fungus that causes ringworm and jock itch. Damp socks and shoes and warm humid conditions favor the organism's growth. What is the most common cause of sudden cardiac death? A. Mitral valve prolapse. B. Cardiomyopathy. C. Ventricular arrhythmia. D. Cocaine abuse. And the correct answer is C. Ventricular arrhythmia. Most sudden cardiac deaths are caused by abnormal heart rhythms called arrhythmias. The most common life-threatening arrhythmia is ventricular fibrillation, which is an erratic, disorganized firing of impulses from the ventricles. What is the most common cause of hyperthyroidism? A. Toxic multinodular goiter. B. Thyroiditis. C. Toxic thyroid adenoma. D. Graves' disease. And the correct answer is D. Graves' disease. Graves' disease is the most common cause of hyperthyroidism. What bone disorder is caused by an autosomal dominant defect in the synthesis of collagen type 1? A. Osteogenesis imperfecta. B. Achondroplasia. C. Osteopetrosis. D. Osteomyelitis. And the correct answer is A. Osteogenesis imperfecta. Osteogenesis imperfecta is caused by a mutation in type 1 collagen. It is a dominant autosomal disorder. It results in weak bones and irregular connective tissue. Some cases can be mild while others can be lethal. Anganwadi workers work under which of the following? A. ICDS. B. Red Cross. C. UNICEF. D. None of the above. And the correct answer is A. ICDS. The Anganwadi worker is a community-based frontline worker of the ICDS program. She plays a crucial role in promoting child growth and development. Which of the following is termed as insulin shock? A. Hyperglycemia. B. Cholecystitis. C. Hypoglycemia. D. Pancreatitis. And the correct answer is C. Hypoglycemia. Insulin shock occurs when you have too much insulin in your blood. This can lead to hypoglycemia, also called low blood sugar. If left untreated, it can lead to diabetic coma, brain damage, and even death. Androgen binding protein is synthesized by which cells in the body? A. Sertoli cells. B. White blood cells. C. Red blood cells. D. Both B and C. And the correct answer is A. Sertoli cells. Androgen binding protein is a glycoprotein produced by the Sertoli cells in the seminiferous tubules of the testis that binds specifically to testosterone, dihydroxytestosterone, and 17-beta-estradiol. The tunica vaginalis is the pouch of serous membrane that covers the A. Testis, B. Vagina, C. Breast, D. Lungs. And the correct answer is A. Testis. The tunica vaginalis is the serous covering of the testis. Which type of anemia is caused by absence of cyanocobalamin? A. Dimorphic anemia, B. Megaloblastic anemia, C. Iron deficiency anemia, D. Pernicious anemia. And the correct answer is D. Pernicious anemia. A lack of vitamin B12 causes the signs and symptoms of pernicious anemia. Without enough vitamin B12, your body can't make enough healthy red blood cells, which causes anemia. Pomegranate is used to treat which of the following condition? A. Hyperkalemia, B. Organophosphorus poisoning, C. Carbamate toxicity, D. Hypercalcemia. And the correct answer is D. Hypercalcemia. Pomegranate is used in the treatment of high levels of calcium in the blood that may be caused by certain types of cancer. Feltis syndrome is a complication of A. Osteoarthritis, B. Rheumatoid arthritis, C. Osteochondritis, D. Myasthenia gravis. And the correct answer is B. Rheumatoid arthritis. Feltis syndrome is usually described as associated with or a complication of rheumatoid arthritis. This disorder is generally defined by the presence of three conditions: rheumatoid arthritis, RA, an enlarged spleen, splenomegaly, and a low white blood cell count, neutropenia. Ivan Pavlov is associated with A. Needs theory, B. Neurotransmitters, C. Classical conditioning, D. Both A and B. And the correct answer is C. Classical conditioning. Ivan Petrovich Pavlov was a Russian psychologist known primarily for his work in classical conditioning. Classical conditioning is a type of learning that happens unconsciously. When you learn through classical conditioning, an automatic conditioned response is paired with a specific stimulus. This creates a behavior. Deficiency of serotonin causes A. Mania, B. Depression, C. Mental retardation, D. Amnesia. And the correct answer is B. Depression. Low levels of serotonin can have wide-ranging effects on your mental and physical health. Serotonin deficiency occurs when serotonin doesn't act as well as it should in your body. This can happen if your body doesn't produce enough serotonin or if it doesn't use serotonin efficiently. Which among the following is not a type of marriage? A. Endogamy, B. Exogamy, C. Epigamy, D. Polygamy. And the correct answer is C. Epigamy. Endogamy, exogamy, and polygamy are different types of marriages, while epigamy is not related to marriage. Which of the following is affected by Kawasaki disease? A. Lungs, B. Joints, C. Coronary arteries, D. Kidneys. And the correct answer is C. Coronary arteries. Kawasaki disease is a leading cause of acquired heart disease in children in developed countries. Heart complications in Kawasaki disease include inflammation of blood vessels, usually the coronary arteries that supply blood to the heart. What is another name for otitis externa? A. Swimmer's ear, B. Plumber's ear, C. Miner's ear, D. Electrician's ear. And the correct answer is A. Swimmer's ear. Swimmer's ear is common in kids who spend a lot of time in the water. Too much moisture in the ear can irritate the skin in the canal, letting bacteria or fungi get in. It happens most often in summertime when swimming is common. Anyone can get swimmer's ear, but it is most often seen in children. Swimmer's ear cannot be spread from one person to another. What is the other name of peritonsillar abscess? A. Quinsy, B. Narcolepsy, C. Pleurisy, D. Catalepsy. And the correct answer is A. Quinsy. Peritonsillar abscess is also known as quinsy. It is the accumulation of pus due to an infection behind the tonsil. Symptoms include fever, throat pain, trouble opening the mouth, and a change to the voice. Pain is usually worse on one side. Complications may include blockage of the airway or aspiration pneumonitis. Treatment is by removing the pus, antibiotics, sufficient fluids, and pain medication. Steroids may also be useful. Admission to the hospital is generally not needed. Leo Kanner is known for his studies on A. Obsessive compulsive disorder, B. Depression, C. Mania, D. Autism. And the correct answer is D. Autism. Leo Kanner published the first systematic description of early infantile autism. He concluded that this was a neurodevelopmental disorder and that these children have come into the world with an innate inability to form the usual biologically provided contact with people. Which vitamin helps in absorption of calcium and phosphorus? A. Vitamin B, B. Vitamin K, C. Vitamin D, D. Vitamin A. And the correct answer is C. Vitamin D. Vitamin D functions by stimulating intestinal calcium and phosphorus absorption, by stimulating bone calcium mobilization, and by increasing renal reabsorption of calcium in the distal tubule. The only human cell that have a flagella is A. Ovum, B. Sperm, C. Zygote, D. Epithelium. And the correct answer is B. Sperm. Sperm cells are the only human cells that have flagella. The flagella of the sperms help them to move forward by making a whip-like movement.